Gauteng Health MEC Kwara Kekana. A very good evening to you, and thank you so much for speaking to us, Ms. Kekana. So reports initially saying the fire was first detected at the hospital storeroom for medical supplies. Is there any more information that's forthcoming?
Very good evening to you, Tepiso. Just to reiterate again that the line is a bit bad that's coming from your side, but I hope you can hear me clearly. I think one of the positives that the echo from my side is just sorted out, but just from your side, so just bear with me a bit. So as we had reported yesterday, the fire broke out at the special dispensary stores of the facility here at Charlotte Maxeke Johannesburg Academic Hospital, which is also just code for a storeroom that is used to store dry surgical supplies and other medical supplies in the facility. So that's where the fire broke out, as we reported yesterday, around 11:30 yesterday morning, and it was detected by officials from the hospital.
And has it been determined if any of those medications stored there or anything else could have been the cause of the fire?
Well, at this stage, the City of Johannesburg firefighting team, that falls within their purview, but also other, relevant authorities as well. And at this stage, they've not been able to, furnish us with that information. But I do think that it's still early stages. As you can imagine, they're still on site, and they were saying they're doing what is called damp diving or something like that. I think it's one of the terms, and I apologize if I'm getting it wrong. It's basically just to ensure that the fire does not reignite again. So they're saying they engage in that particular exercise at the current moment. We just had a debriefing session where they took us through some of those elements of where they are with the operations. But I do think it's a bit early on for them to be able to indicate what could have been the cause of the fire, or potentially as well what could also maybe accelerated and reignited the fire as well.
All right, I appreciate that. So we heard the Premier say that fortunately there were no casualties, but I want to make sure, is that still the case? Has there been nobody who suffered from smoke inhalation or any other what may seem like insidious injuries that may have succumbed to them?
Yeah, so that's still the case. As we reported earlier, we have not received any reports as things stand of any casualties, either from the firefighting operation or from the evacuation operation of the patients, starting from last night up until today, this evening. We've not had any reported casualties at this stage, fortunately.
All right. And services were suspended at the hospital. Where have they been redirected to specifically? We mentioned several hospitals. Could you just tell us where, for those perhaps who may be in the vicinity or who rely on Charlotte Maxeke for those services?
So, one of the earlier things Tepiso was saying is that you can imagine the kind of services that Charlotte Maxeke Hospital provides, and some of it is really quite specialized services. So, of course, even in the evacuation process of the patients, we really had to consider what kind of level of care do certain patients require, and also working with sister hospitals in the province to ensure that appropriate level of care is maintained. Just to give an example, I think one of the issues that we're handling in the wee hours of the morning is the evacuation of about 4 cardiothoracic, patients. So I think outside of Charlotte Maxeke Johannesburg Hospital, Steve Biko also provides that service. So obviously, we then had to ensure that they then get referred to Steve Biko, and their care is then managed at that facility as well. But honestly, Tepiso, it really has been one of the most daunting exercises, but also quite tedious. And I think we really ought to applaud, the efforts and the operation carried out and led by the Gauteng Emergency Medical Services, together with other private ambulance organizations and other stakeholders that have really come on board and assisted us, particularly with the transporting of patients to various hospitals across the province. I think the most important thing is just, inquiring from our sister our sister hospitals as to what level of, what kind of beds do they have, and checking against, the kind of patients that Charlotte Maxeke has, and ensuring that we transfer patients to an appropriate facility that can provide the same level of care that Charlotte Maxeke has been providing to those patients.
Now, just finally, the structure of the building has been compromised. Is it possible that the Charlotte Maxeke Hospital could be out of operation for longer than 7 days?
Unfortunately, I'm not qualified to make that assessment, Tepiso. We're going to rely on our sister department, the Department of Infrastructure in Gauteng, working, together with the the City of Johannesburg EMS service that has been, at the forefront of fighting the fire. And I think once, the fire has been died down, and we talk also about the heat that's emitting from that area as well. Once those things have really calmed down a bit, they can be able to go in and really assess the impact and, the impact of the fire on the structure of the hospital in that particular area as well. So once I think they have done that and within their competency, they can then give us feedback. But, like the Premier was saying, is that Charlotte Maxeke does provide, much needed service, especially when you look at the role that Charlotte Maxeke has played in the fight against COVID-19 and the kind of innovations that have come out from this hospital, the level of expertise as well that have come out from this hospital. But I think also every bed becomes important, especially, during the COVID-19 pandemic. We've seen that we've been, one of the things that in the beginning it's really about increasing the number of beds for COVID-19 patients. So of course, the temporary closure of this hospital, then of course it's a bit of a setback, unfortunately, but we really would rely on our sister departments to then give us a sense of where are we in terms of the structural integrity of where the fire was and when can we resume services.
Kwara Kekana, thank you so much for speaking to us. She's Gauteng Health MEC spokesperson, and as she says, Charlotte Maxeke is, of course, one of those hospitals that provide specialist services. So if you do need more information about where to go to, we will repeat that information for you again.